My involvement with the KCA, there was somewhere in the 1990s where I became involved with the KCA. I made it my career focus as a physician to both care for patients and to do research in kidney cancer back in the 1980s. And I maintained that focus while an active physician at the Cleveland Clinic, and even after retiring, I've maintained that focus to a certain extent. Well, when I started the clinic, it wasn't just me, it was my urology colleagues. We evolved what we thought was a reasonable way to approach the disease called the multidisciplinary clinic, where both urologists and medical oncologists focus on the disease. When we started, the treatment for kidney cancer was a medicine called Depo-Provera. It's a hormone. Didn't work. We tried chemotherapy of one sort or another, and as an interesting aside, every new chemotherapy drug that became available, we tested in kidney cancer because there wasn't anything. And the hope was that we'd find some magic potion that would be useful. We probably went through 30 or 40 drugs over a period of years, and there wasn't any. The disease was resistant. Then in the 1980s, we started to wonder whether the immune response had a role in controlling kidney cancer growth. And we tried some vaccines, we tried interferon, we tried interleukin-2. And while that was all occurring, the laboratory component of kidney cancer research was progressing, where we learned a lot more about how this disease was controlled perhaps by an immune response. And that took us into the 90s and into the early 2000s. In the early 2000s is when the breakthrough came. It occurred because of a series of scientists who were led, for example, by Dr. Judah Folkman from Harvard, who discovered that blood vessel growth was important in controlling tumor growth. What happened at the same time was the development of drugs by pharma that could control blood vessel growth at the microscopic level. The first really important one probably was sunitinib. That was in the early mid-2000s, and it worked. And it was remarkable. And it wasn't a question if, it did work, and the question was how much it would work and why it worked. And that led to what we now have, all the developments. The immune response and the control of blood vessel growth really were the two areas that ultimately led us where we now are and how we treat patients with kidney cancer. It was something that was fun to be a part of. It was most importantly helpful for patients. I mean, we understand a lot of the biology of the disease now, and I think much of what is going to take place over the next 10 years is going to be based on the biology of kidney cancer and an attempt to exploit the way the tumor grows and the way the tumor spreads, more so than in the past 15, 20 years. So I have no doubt we'll make progress. Well, the KCA is moving in the direction of continuing its support of the research approach towards this disease. Although we have treatment, the treatment's still not curative. We still need to understand the disease process, and the KCA is integral in that process. And we can't forget the patient in this whole thing, because they are the individuals who brought this organization along. They're the ones who made it function, and they're the ones who still make it function, right? They require our support and our help. I made the conscious decision when I was practicing that I would retire when we saw the development of, quote, possibly effective, unquote, therapy for kidney cancer. And that was the era of sunitinib, pazopanib, and such. And so my retirement was about 2008, 2009, just at the point where those medications started to have an effect on the disease. Patients, the development of effective therapy, and my colleagues in the field all sort of allowed me to develop what I considered an approach to disease that one could leave as a legacy. I used the KCA to help me develop that legacy, and it was a wonderful ride. I would just like to add for you, the evolution of the KCA has been remarkable over the past 10 years. It's become an organization now that's streamlined, that's clearly current in its approach and its developments, and it's very gratifying to see how it's developed. I think supporting this kind of organization from its grassroots and its founding by a single person and a few docs to what it is now is crucial. So we should continue our support of this kind of an effort. I think it's just gratifying to see how it's evolved.